Hi, so today I'm here to talk about nephrostomy and what types of nephrostomy and how to take care of it, as you can see from the title. So now, what is nephrostomy, you may ask? So nephrostomy is basically an opening that is made between the kidney and the skin on your back. It lets the urine drain from the kidney through a catheter, which is a thin, flexible tube, sort of like a straw. It goes through the opening and into your kidney, essentially. So, what are the types of nephrostomy? Well, there are two types of nephrostomy. There is the Malacot tube, and there is also the pigtail catheter. So, some of you may ask, where is the nephrostomy tube located? Well, it's located at the lower back into the kidney. Well, lower back through the kidney. Basically, nephrostomy is for patients that have difficulty passing urine naturally. So instead, we give them an option of putting a tube. They don't have an option most of the time, but instead we perform nephrostomy, which is inserting the catheter into the kidney for them to pass urine artificially through the tube. So for cleaning supplies, we can start with the pack provided by the hospital, or we can get the refills from a medical supply store. The cleaning supplies, for on the other hand, is we need liquid soap, 4 packages of 4x4 gauze pads, one optional package of a 2x2 gauze, optional of course, and 4-inch coverall tape, which is a cloth tape or a adhesive dressing. And we also need a resealable plastic bag to dispose of the old dressing and used supplies. And also you will need disposable gloves. So the cleaning instructions are very clear. You may clean every other day or when it's wet or soiled or moist. You may shower with site uncovered 7 to 10 days after a procedure. Do not shower with site uncovered if the site is red or has drainage. Clean with mild soap and water. Cover the gauze pad. After that, wash your hands with soap and water. Gather your supplies and place them on a clean dry surface. And then put on a pair of gloves. And go ahead with the instructions that are above. Remove the old dressing tube. Remove the old dressing while supporting the tubing. Throw the old dressing and gloves away in a resealable bag. Also, while you're doing it, check for redness, warmth, swelling, drainage, bad odor. If the tubing has a lock, check the cap on the stopcock to make sure it is tight. Open the two of the 4x4 gauze packages. Pour the liquid soap over the two pads in one package. Next, pour warm tap water over the two pads in the other package. Take out one gauze pad and clean the catheter side with the liquid soap. Work in a circular motion, moving from the catheter side outward. Repeat with the second gauze that same procedure. Take out one gauze pad soaked with water. Using the same circular motion, clean the soap from the catheter side. Repeat it with the second gauze pad. Discard all gauze pads in the resealable plastic bag. Pat the dry area with a clean 4x4 gauze pad. Place this gauze in the plastic bag. And then next, tape the catheter to the skin below the dressing. Check the tubing for kinks. If you have kinks, remove them. Take off the gloves and everything. Dispose it.